Okay, it looks like we can go ahead and get started. Thank you all so much for being here today. I'm Margaret Anton. I'm a senior manager of clinical innovation and research at a company called Two Chairs and have worked in the digital mental health space for a little over 10 years now. It is my pleasure to introduce our two esteemed guests today. And then after introductions, my hope is that I'll actually be speaking very little today, and these sessions are meant to be quite interactive. So we're going to ask those of you who are in the audience to please ask any questions. So we know it can be intimidating sometimes in the big sessions to get your questions answered, but this is the place. We were very fortunate to hear from Trina and Sue earlier today. So if there are any burning questions from that, they're both an incredible wealth of knowledge. So please use this time to get all of your questions answered. So with that being said, it is my honor to introduce Trina Histon, who is the Vice President of Clinical Strategy at Woebot, where she's responsible for accelerating Woebot's capabilities to integrate into care pathways and advance the software transformation of psychiatry, behavioral health, and primary care. And before joining the Woebot team, she spent close to 2 decades as the senior principal consultant in Kaiser Permanente's Care Management Institute, working in the digital health space. I'm also very honored to welcome Youn, who is a senior implementation scientist at Reliant Medical Group, OptumCare, and a lecturer at Harvard Medical School. Her work is internationally recognized, and she's an expert in developing scalable solutions in real-world settings to address the access to care problem in mental health through innovative care pathways, including digital interventions and paraprofessional work. So thank you so much, both of you, for being here, and we're excited to get an opportunity to chat with you. So with that being said, are there any questions to kick us off? And if not, I can start. I always joke, I'm a mental health professional. I can sit in silence if I need.
Yeah, you can. I think we can too.
Yeah.
I'd say use the chat if or the Q&A if folks aren't comfortable just asking the question outright. Feel free to pop it in there too.
If no one else has an immediate question, I have one to kick us off. So, obviously two really incredible experts in this space, and me and my team have been doing a little bit more work moving into primary care in the digital mental health spaces, and as I'm sure to be expected, have been running into a lot of barriers. And I think one of the largest ones we've been kind of dealing with is sort of trying to balance wanting to make it as easy as possible the workflow when it comes to working with primary care clinicians and the staff in the clinic, but of course also, running up against barriers of still wanting to deliver the care effectively and efficiently, sort of within that kind of small available time window that folks have. So, for those, who have experience kind of working in these primary care spaces, I guess, what are suggestions that the two of you have for sort of increasing acceptance and in particular uptake of these interventions in a way that is still effective while kind of reducing burden on provider? And if the answer is to bypass providers entirely, that would also be super useful to understand. Thank you.
Gina, do you want me to go first or Gina go first?
Yeah, I have definitely got some thoughts, and primary care, there's a lot happening in that care setting. I think I reflected in adult primary care doctors have about 17 minutes for a visit, and they're, if you look at the research, 6 to 7 topics. So then you're expecting your referral to happen in that precious time. I kind of zoom out a little bit and look at the context in which you're delivering beyond that. And pediatrics, of course, is a different care setting, also primary care, but pediatricians maybe starting with the well child visit versus, going in maybe with the sick visit. So picking your type of visit where, there's even sort of wellness checks, et cetera, where they might have longer timeframes to at least start, because you're asking somebody to do potentially something new. And then you're also asking them to refer to a solution that they may not be super familiar with. Like most primary care doctors don't get any training in things like cognitive behavioral therapy. So if you think of it like a molecule, like a medication, it's not a molecule that they're familiar with. So even if you're talking and training and reflecting the evidence base, there's still a lot of trust that you're building. So if I think about other things happening in primary care, I would say there are now at least 2 US Preventive Services Task Force recommendations for screening for depression and anxiety in over 12-year-olds. I think the anxiety stops at 64 because I didn't find the evidence strong enough to recommend that. But can you actually be part of a clinical pathway where they're already looking at quality goals and quality improvement? So then your solution is actually part of the bigger picture of how you can support a plan of care. So, okay, if you're screening for depression, for example, with PHQ-9, what are you going to do with all the folks who might have 5 to 9 in the milder symptomology? There's kind of a reluctance to even ask the questions if you're going to unearth the need that they can't meet. So picking out and showing like how you're able to meet a broader quality goal, because I think with HEDIS, et cetera, everybody's kind of tuned to quality metrics and improving quality, especially since 30% of NCQA metrics are now behavioral health. Like, how do you tick and tie in with other quality endeavors would be the zoom out that I would think about. And then, as I'd mentioned in the panel, you're always going to find clinicians who are super excited and who really want to understand this because they realize there are limits to the toolbox that they have. You might have a patient who doesn't want therapy or doesn't want meds to start with, and actually a digital mental health solution could even be that pre-therapy space because someone starts to understand why they're thinking and feeling a certain way. Now they're ready to do, deeper work, etc. So really starting small, like I talked about the crawl, walk, run framing, but starting small, and you might stay there for a bit till people get excited. You have to go through enough of a cycle, and this is where it's hard, right? Where somebody's seen a patient, they've referred a patient to your solution, then that patient came back and said, wow, that really helped me, thank you so much. So they might see the numbers you're sharing with them, but they're going to hear from their patients that they're doing better in their life, and just maybe some of their other chronic conditions that they might be managing. It's almost like that whole cycle has to come full circle, and then they'll start referring, and then they'll hear from their peers, wow, I had a patient with diabetes and depression and this tool really helped them. And I mean, it is a long game, but these are the kinds of strategies where you're looking for the signals of need, which are many in primary care, and you're not kind of adding one more thing, because often in the EMR, the depression screener is the second screen that they never get to see. So like, how are they looking at depression screening writ large? I know I'm kind of asking you to lean into a bigger system, but you're not just implementing a tool, you are actually building a system. And I think people maybe forget that sometimes. That'd be my kind of 2 cents. Sue, what else would you add?
I echo everything that Tina said. I think we just submitted a paper on our adaptation process to bring our program to primary care. So I'll send that to you later today in case you're interested. But what we did is, I think a lot of people bring also providers, like, champions, early adopters to the content adaptation or development process. We actually brought them to adapt the implementation process. So our goal was like, we have a product, we know the key features, everything else that is part of our program core, we will take care of it. It's like working with the users to figure out how to bring it to the existing flows and clinical workflows. So we did that, and that has been actually incredibly helpful. Because what it highlights for you is Trina, for example, mentioned like, wellness visits are a little bit longer. They are. Mm-hmm. And if you talk to a primary care and leadership, you talk to them, that's where they say start there. Great, because that's where usually all the screenings happen anyway. Mm-hmm. So then you can match a screening happening with an action so that the provider is not just sitting there with like, okay, I have all this information now and I'm supposed to act on it and do something, document. But I don't feel as equipped quite yet with the second portion. So then you can tie something together, which makes a lot of sense. If you talk to providers, they're like, oh my goodness, like I have to go through 20 things, 20 systems in the human body. This is yet another one. When on earth do you want me to fit this in? Great question. So I think working with them to try to figure out how to optimize that flow that matches, you can match it to every single, of course, personalized process for each individual provider. But there's key aspects that everyone has to do because they have to. As part of the system, there's checkboxes that all providers have to check off. So are there ways that you can then fit into something like that? So then that decreases cognitive burden on the provider side. And also, to Trina's point, highlights this matching around okay, I'm being asked to do this. Yep. And we're going to take that paperwork away. And we're going to give you solutions that at the end of the day still is going to make sure that your clinical judgment comes into play. And when in the process are you highlighting that clinical judgment? When does the provider feel comfortable having some of the stuff automatized? When does the provider feel stuff that is okay to be farmed out to someone else, different team members, for example? Those are where all of the, in those kind of sessions is when all of that kind of becomes highlighted even more. And it can really help build something that then providers feel, again, more comfortable telling other providers, it is surprisingly easy. This is one of those few things. One of the providers told us in a recent follow session, it is one of the few times that I've ever been able to say in my 20 plus years as a provider that this one was easy to learn. It's for I'm done. My job is done. Great.
Mic drop.
4 months of work. This is why this is the quote we were waiting for. But other people were nodding. So so I think it's really, unless every one of us becomes primary care providers with a couple of years under our belt and we understand all the tricks and all the things, we can't do that. So it's bringing them in to tell us where are the tricks that they use and where we can plug ourselves into something that they're already doing. So that's the, I think, additional piece that I would highlight from what Trina just said. Yeah.
That sounds amazing. Thank you both so much. And Sue, I really look forward to reading that paper.
Yeah.
It's we'll all feel
Very
better.
involved, so you're going to
Thank you
regret
so
saying
much.
that. But yes, of course.
Go ahead, Akash.
I had 2 questions, actually. I was in the roadmap presentation or webinar earlier, and I had questions around pilots. And so I work as an angel investor with my personal portfolio, or investing through my personal portfolio into mental health tech startups. And a lot of the inbound that I get is people at a pre-seed or seed stage that are like, I'm starting a pilot and I don't know what they have a hypothesis, but they don't know the ins and outs of getting to a successful pilot to eventually get further down the life cycle. So my question is, what are some of the, I guess, taking the opposite approach, what is the set of red flags that you see during the pilot process from pre-seed and seed stage startups that are trying to implement into large healthcare systems? And my second question is, what would you want angel investors or investors in general to help in any way, whether they're investing in the company or not, with some of these folks that are going through pilots and trying to integrate with or implement their technology, product, and services into the large healthcare systems? Thank you.
Yeah, I'm happy to take a stab at that first. So first of all, I think it's almost picking your partnership. So large health systems, I would say post-pandemic, and I think Faye reflected this as well. It is challenging to be a pre-seed or seed company and wanting a pilot and to do it with the health system. The challenge from the health system side is they want to make sure you're going to be around for several years if they're going to invest all this time and energy in working with you. However, what I have seen post-pandemic, and I certainly welcome it, is the VC space, including sort of collaborative health systems funding, because they're recognizing part of the digital layer is something that they can invest in and help shape and build, which is great. And then I'm also seeing more and more sort of incubators, which is probably where your pre-seed seed folks should be aiming for. And there are lots of those accelerators or sort of incubators popping up. And then if they're, more mature in the seed stage, then an accelerator. So picking that early partner who recognizes that you don't know all the things you don't know, I think is super important. I think the playbook when we release it will be very insightful to your teams, because it really was the wisdom of the room and the interviews that were conducted from folks from healthcare, from industry, from academia and policy. So I would say watch the space for that. The second thing I think around as an angel investor, I think if I zoom out in the space, understanding that healthcare is complex, it does not move quickly. We talked about sales cycles being 18 to 24 months. As an investor, then your roadmap to the financials will be perhaps even longer. And so, it is going to be that one referral at a time if you're clinically mediated, if that's how you're deploying, and or if you're doing with the payer, for example, if that's the client, a targeted segmentation strategy, your activations won't be as high just because it's not going to come out of the warm relationship a patient has with the clinician. Depending on how you deploy, you could do it via clinician letter. So I think being an investor and understanding how complicated healthcare is, and kind of being in it for the long haul, because it is a marathon, not a sprint. They would be the things that I would think about, and not overloading that pilot with too many expectations. I think right sizing for how do we start, limit data exchange, make it super easy, QR code into your solution, and then be very clear, here's the kind of data we're going to get. And then if we go deeper into integration, then we're going to see more data, but being very clear about what you expect from the solution. The worst thing you can do is kind of go in like a Michael Bay movie and be all hype. And I've had many pitches in my lifetime, and you just develop in those, you just don't trust those as much. Having humility is key, because you're building trust and you're building a long-term partnership. They're sort of things that are top of mind that I would think of. Sue, what else would you add?
I would put a red banner on that last red flag that you just said, Trina. Like the pilot is a pilot on purpose. It's not meant to address all the things. It shouldn't. And if it's trying to, that should be a red flag. If a company is telling you we can do all of these things, that should also be a red flag, especially at that stage. They shouldn't be able to, and they shouldn't do all the things. But having a very clear understanding of what they are and what they're not yet, but having a mapped out understanding of what they will become, I think at that stage is more important, because that's going to guide their many strategic moves around what are we going to address for each subsequent pilot, with each subsequent project, or with partnership and things like that, rather than trying to do what other people are doing or what has been done, or trying to do all the things, because there's just the data that you're going to get is going to be nothing that they can actually replicate. It's not something that they're going to be able to action on, and it's not something that is going to be helpful and additive in continuing to iterating their product to be at a place where it can be scaled to a large healthcare setting.
And I would say, as you do that, start small, share the roadmap, share what you think is these next phases you want to go through, because that shows the customer, client, whatever verbiage you want to use, that you do intend to grow, and you do intend to go into other spaces and places. And in fact, they might tell you, hey, if you develop the thing you have for, Q1 of 25 in Q4 of 24, that will be fabulous for us. So you're going to actually do your market testing as well and get feedback from the voice of the customer, which is super important as you're growing in those early stages as well.
Thank you. Just quick, what's the book that you guys are that you were mentioning?
So the panel we had this morning was based off of our playbook that we're building under the auspices of the Society of Mental Health, Digital Mental Health. And it will be available over the summer, and it kind of goes through all the different phases of deployment, and it's kind of it's baked into it the perspectives of healthcare, industry, academia, and sort of some policy framing, and lots of lived experience in all of those places and spaces, again designed to sort of accelerate adoption, but really showing you the different steps and the different spaces and places that you want to be really thoughtful about. So that's coming over the summer, so keep an eye on the Society's homepage.
Thank you, will do. I think it would be great to if linked to the book, because I would be happy to purchase for my startup portfolio founders.
Oh yeah, it's going to be free. I think it's a playbook, so it's under the Society's pages, so it'll be just available.
Ignore the purchase part.
Yeah. We want to share the knowledge.
Become a member. Yeah,
become a member. That's really encourage your portfolio companies to become a member and participate, because we collectively get better when we kind of share all the wisdom. So
Yeah.
Yeah.
The membership is at no cost right now for everybody. So,
absolutely. Kate, good to see you.
Hi, good to see you, and thanks so much for the awesome panel this morning and for taking these questions. Learning so much from both of your perspectives. I wanted to ask, so for startups that begin with, I think as many do, with selling a service into individual providers or PCPs, let's say, but want to move into systems, what are the most effective ways of identifying and pitching to clinical champions within those systems? And then I guess a sort of tangential second question, given the long sales cycle you all have mentioned, do you recommend that startups target like smaller systems who might have more processes in place as a first step, go after both smaller and larger simultaneously? I'm curious what your perspective on the optimal strategy is there.
That's a really good set of questions, Kate.
Like a very multifold question.
Yeah. I would have said pre-pandemic, you sort of would be looking for the innovation leaders in the spaces, the chiefs of, et cetera, and obviously behavioral health chiefs, et cetera. I don't know if you're getting hit up with by the list of every psychologist on the planet in the US. I get hit up with those emails all the time, which I don't necessarily appreciate, but there are lists out there, I will say that. But I think post-pandemic, I find the healthcare environment very discerning, much more discerning. And I think that's just a product of having deployed many things over the pandemic to meet need. And now there's lots of, there's more sophistication. So I would be kind of zoning in on your target audience in terms of, are you looking at the clinical ops folks, or are you looking at the administrative side of things, or both, and really just I mentioned it earlier, like there's a lot of very big tent healthcare conferences that folks go to, and that's kind of it's kind of grabbing coffee with folks and saying, hey, what are your pain points, or if they're on a panel or whatever, following up with them. That's honestly kind of getting those conversations started and then following up on those conversations. But seeing who in a particular healthcare organization leads that business line or that clinical line, and starting there, and then if folks further down that line, kind of reaching out. It is all about building relationships, and you do it one conversation at a time, one email at a time. But to your second question, you sort of want to kind of, it's a both and. You can't possibly do everything well at once, right? So, think about it, I imagine it's the US specifically you're talking about, Kate, like the sort of problems your company solves for, and then choosing some of the markets, like you can see very quickly on the payer side who the top 20 are, on the provider side, health system, who the top 20 are, and then look at their sort of track record in innovation and where their needs are, because sometimes it's a company who hasn't dipped their toe in the water yet, who knows they have a need and they want to be able to have a layer that's available all the time, to their members, if it's a payer, or their patients, if it's a system or provider, and versus somebody who's got many years of doing it. Like there's pros and cons of going either way to somebody new or somebody very experienced. Either way, there's lots of learnings, but you don't want to have everything in one place. I think diversify, but not so much that you're so stretched. So you want to have the fulcrum of your team and your approach being able to, if both of those customers signed on at the same date, that you'd be able to deliver. So you want to kind of do that demand, capacity, supply planning, and what would it take to deliver for client A versus client B, and what are the set of capabilities that you need in that sort of crawl, walk, run sort of framing that I talked about. There's some of the things that I think about. So you're sort of on the provider side. So what are the things you think about?
Yeah, I think just to add to what Trina said, if there's space for you to be strategic around what evidence do you already have, and then which partnership is going to give you the next set of evidence as quickly as possible, so that it's additive all the time. So if you're truly starting and this is your very first pilot, then usually going with someone that has a little bit more experience in bringing innovation to as part of their healthcare system is going to actually give you the evidence faster because they have the infrastructure, they've had experiences, lessons learned in the past that can partner with you. If you have something like that already and you're truly trying to show, I don't know, the diversity of or the expansiveness of your product or something different, then choosing the next partner that can be kind of start to kind of build up your evidence base in, in a piecemeal way, so that as you're growing, your company's growing, your evidence is growing, you're not showing the same data over and over again, but you're showing different aspects of your company and the growth that you have projected for yourself. So, so that would be the only addition, I think, that that I would add to Trina's. Like the smaller CDOs are great because a pilot can be actually the whole CDO, and then you can say to other, partners in the future, we saturated blah organization as a whole. But usually the smaller ones also, again, might not be as open or have as much experience with innovation, in which case that can be a little bit rougher as a starting partnership in terms of getting the data that you need and then getting the lessons learned quickly for you to be able to be ready for like larger deployment. So it's really wherever, and if you can do both, great. Yeah, but to Trina's point, like being able to make sure that you can deliver on both.
Super helpful. Thank you both.
Of course.
And you know where to find me, Kate.
I do.
Before we jump to the two hand raises, there was a somewhat related question in the chat that's from the perspective of someone in a health system who is interested in being a champion for a product like Woebot that they've heard about and are curious how you might be able to kind of champion that within the health system and build partnership that way.
Yeah, well, I guess the first thing I'd say is to reach out if they were specifically thinking about a Woebot versus another company. And many of us are on this a part of this conference, but to reach out directly just to kind of so we can understand needs. But again, if you're kind of an entrepreneur versus an entrepreneur, right? I would have classed myself as an entrepreneur, as a case permanente. You're really kind of listening for the clinical need. You're listening for the business needs. So maybe you're in a vertical where you're more plugged into clinical ops and you're feeling the pain points of the access issues for mental health, for example, like people really wanting appointments, but we just don't have enough humans to meet the need, candidly. And I'm not sure we'll ever hire our way. That's certainly something I've heard from many health leaders in post-pandemic. And then I think it's also a care experience. So if I think of on the insurance side, you want to make sure that person will choose you again come open enrollment. So you want to be able to support their needs around mental health if you're a payer. And so how are you supporting the members getting, paying for your insurance, receiving things? So kind of understanding across, where your business sits in the marketplace, what your competitors are doing, because again, I think nobody wants to be lagging in any provision of services. You want to be either, at the level where everyone else is, or you want to be leading, depending on that. So really looking at where are you in relation to other entities within your geography, and where is your biggest competition, and then how are they doing and what are they doing, and then how can you raise sort of adding digital mental health to an existing plan of care. Where will it add value? What are the populations? So thinking of the strategy of, are you going to start with a population of maybe folks who've diabetes and depression? That's kind of a very narrower set, but we know if we don't address mental health issues and physical health, it will just be a very negative impact for that person who's got chronic conditions. So they're kind of some of the things I think about. And then really finding out what's keeping those leaders awake at night, or what gets them out of bed in the morning, and really plugging into what their needs are and their timeline for making decisions, because it's really kind of now-ish for 2025 budgets. So you kind of don't want to miss that opportunity either about when are the investment decisions being made. So they're kind of some of the things that I think about, but you want to think about the use cases and build the potential for a deployment of digital mental health around those use cases. And Sue, you live this every day.
So I think what is unspoken from what Trina just said is that you should absolutely make time to have all of these learnings, all of these conversations, all of these, things that you're going to be relationships, everything that Trina just said. Like, it takes time. Just because it's happening in-house doesn't mean that the timeline is that much different, maybe a little bit faster, but not necessarily by that many more months. So if I forget, Margaret, if you said it was a provider or someone within the healthcare system, like, depending on where you live and what is your main job within the healthcare system, just making sure that you have the time, or you're able to somehow craft the time in order to have all of these meetings, all of these thinking time, and all of these conversations. Because as Trina was listing all the things, I'm like, yep, that sounds all right. And that is all time that, you're going to have to, it's going to wake you up at 5 a.m. So
Yeah. Stretch project. I suspect a stretch project.
yes.
Thank you both. Azair, I'm sorry if I mispronounced that.
No, you're fine. Thank you. I'm Azair. So I'm a founder of digital mental health startup. I'm a sole owner, and my questions kind of build on what the last few questions were. I'm from the background of healthcare interoperability, so I identified a need. I'm heavily invested in standards like FHIR interoperability, which is my expertise. And I've also been a patient for the last 18 years. So it's a lived experience I've had. So I took upon myself to make a change. But obviously, some of the things you pointed out, maybe I tried to boil the ocean, maybe focus on one thing, but I've made those mistakes. But it's been 2 years and counting. I'm still going, but I'm not sure how to get traction or how to reach out. Like, let's say I want to reach out to Sue and say, okay, I've built this product, and so the typical path of the raising funding, that's not what I anticipated. Looking for merger acquisition, but sort of something I really believe, everybody believes in the idea, but I really believe as a patient, as on the mental health side, interoperability in exchange of standards, lack of physical and mental data sharing. I also happen to have some chronic things that happen because of some things. So I know for a fact how these things, that's what the challenge I try to do every day. I do also now have to go back to day job, to leave that side. So there are a lot of things going, but I want to contribute as much as I can, but obviously lack of funding, a lot of access, but I'm deeply passionate about this. So I want to see what can I do to further, with just limited resources, limited funding, and to make a difference and take a mission which I deeply value. And I know it's not a sales pitch. I apologize if it's coming across. So,
No,
but I'm just
don't.
yeah. So those challenges as a sole proprietors or owners who believe heavily and who have, some other experience as well. So it's and I can go on and on about the challenges that the lack of physical mental health integration are causing. Also, in terms of resource allocation, low providers waiting 6 months for a doctor to see me. Giving me 10 minutes to see a patient, and then no data sharing. I have to fax my records. They don't know my blood history. If I have low iron, low vitamin D, what can it cause? And it has correlations that I've come across. If I have sleep apnea, I might have something else. So if they're not talking, there's a huge challenge already. So that's what I'm trying to overcome. So I'm happy to see what I can do and what help can I get in this.
Yeah, well, first of all, thank you for being so vulnerable and sharing in framing your question so much about your own lived experience. I think I'm happy actually to see more and more people with lived experience starting companies across the continuum of care, because you're bringing a very different reality and a passion than perhaps those that don't have that. As you're speaking, like I'm imagining you heard our earlier panel, and someone like Faisa High, I know like she participates in a lot of accelerators and incubators, because it sounds like you're at that point where you've developed your idea, it's mature enough, and then you have what many don't have, which is that interoperability lens really built out, because that's often comes later in the deployment pathway, to be candid, because as you know, healthcare data is considered category 1 data, and app data is often considered category maybe 3. And so you really have to make sure you want that app data in with the EMR to make it valuable. And so that journey can often be long and arduous, but you already understand the FHIR standards and the interoperability. So you're ahead of most people. Let me just frame that. But I really do feel, and I don't know what part of the US you're in, but there are so many sort of incubators and accelerators that are starting up. And I've been fortunate enough to been a mentor for the OneMind one as well. Like, is there any sort of opportunity locally where you are, or even plugging into sort of the academic medical, like this society is a place you're here now, and I think this is a good question more broadly than this AMA, but there may be members in the society who are academically plugged into what you're doing in the area you're in, who want to understand that other piece you have, and or as I said, the accelerator incubator space, because I agree with you. It's on average 11 years from first symptoms to when somebody reaches out for help, and then it's a really, really difficult journey to get the help and the time. So I certainly feel how frustrating that's been for you. Sue, what would you add from sort of a provider side, just kind of again getting traction and getting attention?
Not much on the healthcare side, unfortunately. I think the unfortunate reality is, unless there's some sort of in-house way to help build this kind of partnership with a starting company through the innovation arms or departments within healthcare settings, that's not something that, for example, I will be partnering with at the stage that I'm in, because we're looking for companies that are a little bit more established, and we're looking for larger deployments. But just I echo what everything that Trina just said. So definitely connecting with Faye as part of, she was presenting earlier, and this is her space, and she knows everybody and everything.
She does.
So I'm sure she will have a lot of also great insights and suggestions for next steps too.
Thank you. Appreciate it.
Yeah.
Thank you.
Can I ask my question? Yeah,
Yes,
I'm
please do.
very curious. I work at Kaiser Permanente and worked on an implementation of trying to get our pediatrics providers to offer a digital self-care tool, Woebot, actually, to adolescents. And I think, we had some ability to get the providers to make this offer, but I think one of the huge pieces was just the uptake, from the side of the patient, and providers sensing that the patients really aren't interested or don't see the need. And I'm just wondering, just on the side of uptake, like how you begin to understand where the problems are and make movement in that arena, if you have any thoughts on that side of it. And the population we're working with is youth who screen positive, but they're mild to moderate. So I don't know if their level of symptoms probably would play a role in their motivation.
Yeah, I'm happy to. I obviously was part of that with you, Davida. And, I think, first of all, I'd say adolescents are very different to adults in terms of digital mental health. And, I think even if or when screening efforts are happening in primary care, sort of the pathway from understanding where somebody is with the PHQ-9 of maybe milder symptomology, and then that sort of crossing that O gap or that operational gap of, yes, I have this need and now I want to be able to leverage this tool. I think making it very easy to get in an adolescent's hands, obviously with the consent of the parent, which generally happens at the time of visit, that's almost one of the biggest barriers, if you can even download it in the office when you're there. And I think sometimes with pilots, you're starting off and you're deploying a certain way because you just want to get things in the water, but you've maybe made that piece of it have some friction, if I can kind of think of it that way. And you may get 10 to 20% of adolescents who'll be interested in a digital mental health tool. The other reality is, you know, obviously the clinician's office and that sort of trusted relationship is one space, but because they're adolescents, their peer salience group has even more gravitas, dare I say it, than their pediatrician, even if they've been their beloved doctor since they were knee high to a toadstool. And so they're listening to their friends and what their friends are doing. And so it's very hard to have that sort of deployment scenario where, you know, obviously within Woebot, there isn't a way to address sort of that peer salience and still be a steady non-judgmental friend to help somebody think through maybe some scenarios. But you are kind of against the noise of the social media companies who are really, really good at getting attention. And I don't know if you heard Ali's keynote, but I think obviously with digital mental health, you're trying to get somebody to leverage a technique or a concept of, say, CBT to help them feel better. It's not just to get their attention and keep their attention and keep them in. And so I think we're always at odds in competing in digital mental health in adolescence with the companies, and I sort of won't name them, we all know who they are, who really know how to grab your attention and keep you in the loops, even if they're brief instances of content, they go on forever and ever and ever. So I think what's the friction point of getting the tool in the adolescent's hands? And then are you able to go back and nudge and say, hey, you know, your doctor talked to you about this? So that nudge capability with adolescents, because they've probably forgotten and they're thinking of they're catching up on their phones with their friends and they've left the doctor's office and maybe with parent or guardian in the car heading home. So where are the spaces and places where those nudges can happen? I think it's, you know, it's just a more difficult population to deploy in, candidly. And, you know, Sue, I think you're exclusively in adults, if I'm right, in your deployment.
We are. In
yeah.
my previous life, we partner with organizations to target the young adults. So drawing from that, transparently, I would ask them, Davida, if you guys have access to like even the patients that said no, I'm not interested, or even the ones that say yes, and all the different arms, the ones that said yes and went through, the ones that yes and didn't do it, the ones that no. Just to hear, because if you guys are kind of set on doing this at the doctor's office, which transparently from what we've heard is not the best place to implement anything, even healthcare related for this population at this age group, then potentially having the provider be the one that has the conversation might be too late. Like, you know, some suggestions that we've heard is like pulling it up, like if especially if it's like a 16, 17, you know, older adolescent, then sometimes they have access to their own, like, you know, ways to complete some of those measures, those pre-screeners, then putting the bug at that point for the user to grab right after they do their own screening without involving an adult, quote unquote. That has been, it was actually a suggestion that we've heard frequently from our focus groups and individual interviews from, again, in my past life. But there's something about like, oh, my provider asked me, I don't, it's probably lame. I don't want to, even if it's like something really cool, like the fact that it's coming out of the package of my healthcare providers telling me, it already tells like I don't want to try it kind of a thing, unless it's like really bad, which again, if you're targeting mild to moderate, maybe they're not that right there yet, and the change on spectrum for behavior. So I think if there's any opportunity for you guys to hear directly from the patients, that might be best. And if there's any potential to take it out of healthcare or put it somewhere else in their healthcare journey for the patient
Right.
response,
Like peer
maybe better.
support specialists seem to be
Something
a
like that.
growing role in healthcare in the adolescent space, or peer or near peer. So they're hearing from somebody close in age or cool enough to be just a little bit older than them on how something helped. I mean, it's so compelling, and testimonials, like we know those kind of particular tools work as well.
And what is it, like to Trina's point, like the communication aspect, I think becomes even more salient when you're targeting that population. So if there's even any impact or input that they can have in changing and modifying, like how to share this resource with this age group, that could also be something helpful.
Yeah. Thank you.
Yeah. Good luck.
I believe we have time for one last question. If no one else has a question, I'm happy to ask one. Earlier today in your presentation, you were talking about how health systems have become savvier and require more sophistication from the types of companies and products they decide to partner with. I was hoping that you both could elaborate a little bit on what that looks like in reality and what some of the expectations are for really establishing a partnership from a health system perspective.
Sure. I think the biggest thing one is it's truly, we come back to data. Like, you don't have to have published stuff. I think that's like, you know, very, very different, and it's a requirement. It's not a requirement. It's like, oh, really nice to have, and it does give you some different level of credibility. But just having strong internal data mechanisms, and also understanding and showcasing and conveying that the company takes data very seriously and understands the value of data-driven decisions, data-driven changes, data-driven strategies. And it's not just like okay, they want me to report on these things, so I'm just going to check off the box, but like really using that to give the signal within the partnership that this is one of the other aspects that really differentiates them, the vendor and the program and the company from other competitors out there. And from there, like really being able to vocalize, like for your program, like why you're evaluating X, Y, Z versus, you know, maybe some of the most standard stuff that you might be able to find from other companies that they do. It's really, so the savviness is coming from, you'll hear a pitch and then people start asking questions, just like we're hearing in this kind of venues. And it's very quickly kind of starts to differentiate those that have put in the initial thinking process around, like, we're collecting this data specifically versus the other thing because it helps understand this aspect of our program or that next step that we're building, versus we're just doing it because, you know, we've been told, or because it was the easy thing to do, or because that's what most people are doing. And it really just kind of sets people up a little bit differently within the relationship and the partnership. So being, I think, a little bit, spending even like a little bit more time just thinking through those will really have big ROI later.
Absolutely. You know, I would say the other sort of growing sophistication is, you know, healthcare is a first do no harm framing. And I think we've kind of now, I think, moved into the space where I personally believe we're in the second generation of digital mental health tools. And so there's moving fast with intention in the space. But I'm certainly seeing more sophistication around the care continuum suite of solutions. So leaning into SMI and areas like that, and different aspects of what people may be dealing with around, you know, their mental health. And I certainly welcome that. I think the health of the field is contingent on us being both broad and deep as an industry. I would also say, you know, given the environment of healthcare coming out post-pandemic, a lot of digital transformation happened. And now there's kind of almost a recalibration of budgets and, okay, where are we putting our digital investments going forward? And I think I mentioned it on the panel as well, that, you know, thinking about privacy, security, data use, data storage, you know, your servers in USA, you know, your technical risk office in a health system and the legal team are even more savvy post-pandemic than even before. And of course, the rules, the paper and the rules and regulations at federal and state levels have also been evolving. And so making sure that you're keeping an eye on all of that and that you're compliant, that you're thinking about, you know, Ali in the keynote reference to quality management system, like how are you showing up as a company? I think there's just more and more expectation that there's a level of maturity that you're going to be as a partner than pre-pandemic. So that's the other big thing that I see.
Sure.
Thank you both. Thank you both so much. This has been wonderful and so informative. We have about a 10-minute break until we head into our flash talk. So thank you all for being here.
Awesome. Thanks for all the great
everybody.
questions. And Sue, thanks a million for
Always,
this.
Trina,
And Margaret, thanks a
pleasure.
million for moderating. Really appreciate it, everybody. Take
Thank you,
care. Have a
Margaret.
good rest of your
Bye.
day. Thanks, Margaret. Bye-bye.